just wait for 1 more minute. Should we start now, or
Yes,
what is that you're recommending?
No, ma'am, we will start. We'll start the program. No problem. Meanwhile, the student faculty, they will join. You'll start.
So, good evening all, and let me have the honor to welcome our speaker, Mr. Dhaumil Parmar. He is an electrical engineer and alumni of IIM Calcutta. He is a NSS State Award winner. He is SDG expert, Sustainable Development Goal expert, and mentor for few startups. Mr. Dhaumil has always vision to create better society by bringing the change on the field. Mr. Dhaumil started company Redicine Medsol with a couple of friends. Dhaumil has represented Redicine in US Embassy's Nexus program, Unleash a global innovation lab based in Denmark. Redicine has become one of India's first smart medicational solutions. With this, I also would like to add few more points. Recently on 18th August, I, along with our colleague from the same research center, Dr. Sushant Kumar Patnaik, we have attended EDII at Ahmedabad. And there we met Dhaumil Parmar, and there were a couple of other startups plus different institutions. I believe 186 institutions were there. Students from those institutions were also demonstrating their their projects and their products. And I saw Dhaumil Parmar is also there. And while I was going through all the startup and I was going through all the product, his small innovation got my attention. And I was standing there, he was explaining this to some other participants over there. And I listened to it. It was very much interesting. So at that was the point I decided that, let me request Mr. Parmar once the program is over. I collected his card and I said, I'll connect you later. And I thought of, if he is agreeing to it, then our student would be definitely going to get benefit. So with that reason, we got connected, we are here, and I do expect, because mostly students are from a pharmacy background, and we have also students from different background, engineering, managements, and in engineering also different backgrounds. From engineering, from BSc we have students from forensic, from radiology, but majorly this audience is dominated with pharmacy background students. So with this, I would like to hand over the session to Dhaumil, and I would like to request you to share whatever insights or information you would like to share with the pharmacy students, so that they can be the next Mr. Ajay or Mr. Sobhik Mandal, and we would look forward to them. Thanks.
Great. Thank you so much. Thank you so much, Dr. Madhusmita, for inviting me. I think it's a great pleasure to be here. And even after the 7 o'clock, they're having this pool of 89 people, 90 students, and still counting, I guess. Students to agree to listen to this kind of things, it's very inspiring. And I think it's always nice to interact with the young entrepreneurs or young students, because they are, as I always say when I go to meet other people, etc., the young people, the students are the pillar of our Indian economy. But just first, I would like to thank everyone who is here after their college hours or in their social life hours. So thank you so much, everyone. Just a quick thing. If you are able to hear it, I just wanted to know how I am addressing people. Just put anything like a small thumb snap or anything like in the chat or in the interaction. So I'm aware that people are awake in this. Anything, a small interaction could be fine. So I'm aware, yeah, that's a whole lot of people out there. So
yes, a chat response in chat window would be appreciated.
Yeah, that would be great. So after the COVID, this whole physical meetups are into this digital thing. But yeah, I'm still learning on to this experience. Okay, meanwhile, I'll start with, as Madam said, as not more of a journey, what I want to say or whatever I want to convey to these people. It's moreover what I have experienced in my life, what I have become today. It's about the whole experience that I had in college or in my management college, or after that I learned earlier in my job. I'm yeah, okay. I'm hope everyone is able to hear me. If there's any problem or you have any questions, just put right into the chat box. I'll able to answer some of the query or as far as I can. So first of all, I would like to start with how I got into this healthcare ecosystem. So I'm not of a pharma background or from a healthcare background, as Madam rightly mentioned. I'm electrical engineer by the core of it. So 11, 12th, I had a good percentage. So we decided on to the, going with the flow. I know somehow some of them might able to interact with on that part. So parents said that this is an interesting field, you should choose this. So that mindset at that point of time was very limited. And so that went with the flow. I didn't have my decision making at the time. So yeah, in the first year, I joined this electrical engineering in one of the college here in Ahmedabad only. And after the first year of my engineering, I got to know that I'm not able to come. I will not able to complete this after 4 years. So I have to look for other options in this whole life. So let me just look after what I can do, what I'm good at. So that was the first realization happened, that you should not continue with something that you are not passionate about or you don't love things about. So I was more passionate about interacting with people, that sales side and operation side. So in college I started taking parts in theaters, I started taking parts in different college events. I was in NSS volunteer, if you might know about it. So I participated in NSS, I joined a couple of NGOs, and that whole social interaction part trigged me really well. I think I was really much connected with the problem statement earlier at that time also, that whatever the problems we have in society, I tried to look for the solution that we have. If the people are, facing with some of the problems that they don't have enough food, so there are people who have good foods they can supply into. So we used to go over there, give the food supplies to a couple of people. I used to go to teach underprivileged children in rural areas and etc. So that point of time happened in my college life. And I think even if you ask me any electrical engineer question, I will not able to answer that question very truly. But yeah, that happened. I completed my engineering thoroughly, and later on, after the fourth year, I did realize that yeah, the sales operation that side looks really interesting. I think meeting with new people, interacting with things, and able to sell your ideas, your vision to some other people who need that. So that sales lifestyle really triggered me. I did my then management from IIM Kolkata. That gave a lot of experience onto the management side, on practical side. Later on, I joined an housing finance company. In between that, so me and one of my co-founder currently, Kush, we were in college together. So Kush was really into the technical guy, but we had the same vision of solving the problem. So in the fourth year, we did a project of 3D printer. We developed one of India's cheapest 3D printer solutions that we've created at that time. But due to commercialization problem, we dropped that idea. But in the fourth year, I still remember. So me and Kush happened to discuss this more over than often. So we used to go to the usual chai place, and we were discussing about. So one of the Kush aunt were struggling with the problem of medication. So now I'm starting to tell you that why we created this device, what triggered our initial idea onto that point. Sorry for the background noises. That's a beautiful peacock in the background of my office over there. But so yeah, so Kush was discussing about the idea that one of his aunt was diagnosed with cancer, and she had multiple medications problems. So he had a call that my tablets are still missing. I'm not able to take that on time. We had that whole discussion that how serious is the problem. So he was telling me that he had taken like 1 month ka medicines over there, and that whole 1 month ka medicine goes over for 1.5 to 2 months. They hired also nurses. There were two home takers at that time, but still some medications are able to not able to take that on time, and due to that they were having some medications problem onto that time. So as curious as we were, that engineering part I was able to solving the problem, that is core engineering. So we looked into that how serious is this problem, and we looked through a couple of journals, we researched off a little bit, and we got to know this is a really serious problem. And surprisingly, I know you are pharmacy students, you take their medicines on time. So this I'm talking about the people who have chronic diseases like cardiac, like cancer, and the BP medications. So these are the people who are not taking their medicines timely, and the adherence rate is around 40-45% only. So when we looked into it, we got to know that this is WHO's third global patient safety challenge, and there was no such solutions in the market. We go through you might have that at home also, that Monday, Tuesday, Wednesday wala, we have that boxes. We used to drop our pills into that. Then we looked into it, that why people are not using to it. Then we got to know about that if you put two different type of medications into that, there is might a small, pill to pill interaction available onto that part. So that was a critical part. People are still using that, but yeah, that was critical. So initially that we thought that there should be some solution onto that part. That that was a simple thought that we have. I think many of us already have that thought initially, that should be a storage solution, that people could have their medicines available at the predefined time. They can take their medicines, as simple as that. There is no such hard things on that part. But yeah, and then later on to that, this the idea that we have, and then we were a little busy with my management, and Kush had a job in the Torrent Power. And later after that, in jumped on to 2018 2019, we were discussing again the same. And one of the doctor in Kush's family suggested, had this idea available earlier. What are you guys doing about it? If you are interested, just make the solution. I'll be really interested on that. So in 2018, we participated in one of the healthcare event happening in Ahmedabad. So that healthcare event was basically focusing on the doctors available. So we use a simple poster. We make the simple poster that we will solve this kind of problem. We'll create a box and connect with our mobile, and we'll solve this problem. That was an easiest, simplest solution that we created. That will solve this medication problems, and the problem statement that we know, that data collectively put on board, and we created a small presentation onto that part, and we got a great response onto that. So that was a triggering point, that we realized, oh, problem is there. We identify a solution, but there is a market for it. So people are interested to have the solution. That market part, we did realize on that point, that almost there are around 200, over 200 doctors were present in the conference, and many of us showed that interest. Yeah, if you guys are able to create something like this, so tell me when you guys are done. And we got this great response. So then we thought, yeah, this is something really great we are trying to do. Let's do something about it. So I called one of from my networks, that if someone is able to do that electronics wala part, that coding and all that part, because I had that sales wala mindset. Kush had that whole growing the business onto that side wala market, but we need some that technical guy who is able to create this whole system. So I got the friend in one of parallelly with our jobs, obviously. So I had a job in a housing finance company. Kush had a job in Turn Power, and one of that friend, we started working parallelly on this device. So when we started telling people that we are creating something like this, people are very intrigued about it, and we really thought that this is something that we can do. And because we all are good Jews, so at some point of time in our life, we triggered that good Jews in our triggered. And we should carry it forward as a great business idea. Then we look into the business side, and later on, this COVID happened, but later on, we were able to develop something out of it. I'll just show this thing that I am available currently with me. We have developed this kind of devices currently. Yeah, you are able to see this, I guess. Yeah, this is the kind of device that we have developed. Just simply, as simple as it sounds, you just have to put your whole strip of medications into the devices. With your mobile application, you have to just set up that which medicines you are adding, at what time medicines are about to be taken, and at a predefined time there will be LED indication onto this compartment, The display will show the name of the medicine and number of doses, and the buzzing sound will happen. So whenever the patient has to take the medicine, he has just to put out, take out the strip, take the medicines out of that, and they have to take the medicine. As simple as that. We did a patent on a product, and as we grew into the market, we did participate in couple of competitions, you can say. So as Madam rightly mentioned, I was part of US Embassy's Nexus program, and that was the key insights that we have from the mentor side, that how we can put this idea available to the more and more users. Like, it's a simple idea that we have for the chronic patients, they should able to take their medicines on time. So they got to us that how it can be useful in hospitals, how it can be useful in the pharmacy companies. That pharma companies, I thought the from the pharmacy background, you might really understand that pharma companies are really keen on the clinical research side. So talking about the Indian ecosystem, there is no such devices available where the patient can take the medicine taken, they used to know or not. So that whole thing is happening. And that guy suggested us that you should put these devices into the clinical researches. So we approach a few of the companies, even the pharma companies and clinical research companies, that this is the solution, and you'll get the whole detailed adherence report, how much medicines are taken, how much medicines are missed, and the whole data you get. And the things went crazy after that. So yeah, I think we are the India's first company to create this kind of devices. Our IP and that all are available with us. And after that US Embassy's program, we participated in Unleash, which is a global innovation lab. We were one of the you can say one of the team. We were choose around the globe of 54 teams. We were one of the that, and we were in the top 10 team into that. Later on, just recently, a couple of months ago, our company was selected in the Royal Academy of Engineering, which is a UK government fellowship program of leaders in innovation. And Redicine was selected on that part, and they go through the whole mentoring and acceleration process. Kush was there for a couple of months in the Cambridge and Oxford, and we represented Redicine over there. So throughout our journey, we faced many more issues, and the thing I think is the key for entrepreneurship is the patience. So when we had this idea in 2018 2019, and we are trying to solve, trying to create this kind of solutions, we had our jobs in hand for a year. After a year in 2020, we left our jobs, and we went for this, for with the full force, you can say. And at that time, the COVID happened, and there was no things available in the semiconductor industry. As you might know, the small ICs and chips are mostly imported from US or China. Some of things are available, but the whole import export industry was staggered, and we were clueless that what we'll do, what will happen if we are not able to source the chips. But at that point of time, we had that patience. We were able to think that, let's see, if you are not able to create a product, let's create our customers with it. So we participated in multiple acceleration programs, we participated in incubation programs, and we created our learnings from it. So what we will be able to do with our product, what we'll be able to do with our business cycles, what we'll be able to do with the product in the global market, that whole aspects we were not able to understand at that point of time, that we use as a learning in the period when we were not able to do anything on the product side. So that happened, and it really triggered us that what we are today. Currently, we have tied up with a couple of good boxes, a couple of good hospitals and pharma companies around here, and we'll be using these devices currently in the Indian market. But after a couple of months, we are trying to go global with it. And yeah, that's a couple of things on my side. And I'm sure if you are there are a good crowd of people around here, if you can raise any hands, if how many of you are interested in entrepreneurship or planning to start their own business, if you can raise a hand or drop in the chat if there are any good entrepreneurs or business people in the audience. Okay, yeah, moving on. I'll just keep on talking. If anyone has any questions on that side, you can just drop in. yeah, just still just extending on the part what we did on the Redicine. And so yeah, that whole journey happened, that the medicine people are not, the aunt was not taking on timely. We created a company out of it, and we are calling it Redicine. We are redefining the medicine solution, and that's how we are into the picture. Currently we are just closing one of our investment round, that whole Shark Tank thing we did. And yeah, one of the investor was really interested to join boards with us, and we are just closing that round. And yeah, we are we are of resources available with us. Whenever we go with unique solutions into the market, and we connect with people, well, let's say we connect with some hospitals, or let's say we connect with some we got that learning out of it, that why people are not using. We try to make it more user friendly, we make the user experience more and more easy. And that's how we try to convey, with every pitch we are trying to exaggerate what we want from them. So we stopped selling our product. We suggested them that this is a product, and this can give you this much benefits. With her product, you will get a good marketing experience. With her product, you get the data that how many patients are taking the medicines on time. So that was the approach that we tried to change. That, we don't want them to say this is a solution. We want to say that this is a thing that will help you grow your business. And that helped really great. I mean, you can say that, we all want something for ourselves. Yeah, so when we see that something is coming, something is beneficial to us, so people use that, and they are really interested onto that part. So that is on my side. I think if you guys have any questions, I think you can unmute, or you just put it in the chat box. Madhusmita ma'am, if you want to ask any questions, I'm open to it.
Great. So thanks, Dhaumil. So you made it the entire session without a PowerPoint presentations.
Yeah.
And that's the interesting part. You shared your journey,
Yeah.
you shared your experience, and as requested, you also did, demonstrated the product. So there is a first question by Chandan: make medicine at a low price gives profit.
Yeah,
So
I think Chandan, many of the companies are currently trying to do. I think government of India is also this program, Jan Aushadhi Kendra, I guess. So what they do, I think every medicines have this thing. So medicines has this formula, and when this formula goes in general, so many generic companies comes under the picture. But yeah, they still have a very gross margins available onto that. So those companies work on the principle of quantity. Let's say Zydus is selling a medicine on 50 rupees a tablet, but once that formulations go into the public, this generic company goes as a 20 rupees per medicine, and that cost is still, at that cost also, still they're still running around 20-30% of the profit. So yeah, making medicines as low prices gives profit, but a lesser profit, and you have to go into the bulk of that, because India is such a segment that we are really price sensitive. So people are really sensitive about the product. We have something at 100 rupees, and they really try to go for like 20-30 rupees. So, but and most of the people are low income segment people, so people are keen to buy, affordable things. So yeah, low price medicines market is there, and it is turning on that.
So you are just mentioning about the low price, affordable. So what would be the cost of this medicine box, pill box? I think I lost. Um,
Can you just put it in the chat box if it's fine, or you can say now. Currently, your voice is clear.
okay, so I was just asking the what is the cost of the pill box, like the
Oh.
price of the pill box? Yes.
And interesting question. So we are currently trying to sell this around 4,000 to 4,500 for this typical devices, and we are coming up with a next solutions. Will be a compact device, which will like a power bank device that you can carry anywhere. So this is more of a home care devices. So if you have patient at home or old age people that you want to remind them about, so this is much more on that side. Our the compact product will be much below 1,000 rupees product, and that will be cost effective and easy to carry product.
Okay, so like they might be having some questions, but yeah, I have one more question. I generally ask more questions. So my mom is healthy, but still she eat this sugar, this diabetics, and this gastric medicines on time. So let's say that day you have demonstrated lights would blink. So
Yeah,
is it something like that, kind of alarm, like if they miss, I think again I missed internet connection is
yeah.
continuously dropping.
Just close off your video. I think that would be better for
Yes.
Yeah,
Okay.
yeah.
So what my question is, like, is there some kind of alarm system? Like if someone missed their medicine, it would continuously give them the alarm, like we do have the morning alarm. So I think that
We
can be.
don't, so we don't have this alarm with a missing part. But yeah, when the time is happen, let's say there is an 7:30 p.m. and there is an medication alarm goes on, and if you miss that medication, that notification goes to the caretaker available with us that person has missed the medication. And so there is an option when you have a medicine alarm available, either you can take it or you can snooze it for 10-15 minutes. So if you don't attend, it will be missed. And we don't recommend that even after 10-15 minutes you take out the medicines, because the medicine timings are very critical. If you are instructed that you have to take medicines after dinner, so yeah, your metabolism at right at that time, so if you take the medicines on time, that would be great. But yeah, answering to question, we did notify the caretaker that this patient or your beloved person has missed the medications, and so they can get a note about it. And at the same time, you'll get the whole detailed adherence report on mobile, that let's say after 3 or 4 days I connect my phone and I'll see that okay, 18 after 3 days there are 15 medicines and 9 were taken on time but 6 are missed. So yeah, that whole report you get, and at the same time you get the notification if it's missed or not.
Okay, great. So any further questions from the participant, as mostly you are from pharmaceutical background? Do you have any question? Or Guru Datta sir or Himansu Bhushan sir?
Yes,
If you have any questions, sir,
madam.
please.
Yes,
Yes, sir.
I want to speak something on this. So congratulations, Farmer, Mr. Farmer.
Thank you.
So a great innovation. So definitely it is very motivational for all of us. So you are quite true that during the time of means when a person is not well, at that time he or she has to be take more number of medicine at different time interval.
Yeah,
It's
exactly.
quite true. So there of medicine, and that is the reason, if you will find in the hospital, the nurses, it is the work of the nurses, they will make a chart of the medicine chart.
Yeah.
It is a common practice. So I will suggest, if you are also talking about the marketing, so if you will means give a presentation in hospital management, so I think it has a great requirement at that hospital part.
Definitely. We did that actually. And
Yes.
when we were researching onto that part, we connected with a couple of good hospitals in Ahmedabad. I'll not able to share that names, but yeah, we talked with hospitals, and the hospital management told us even there are nurses available with them, people still miss the medications because nurses have the long things to do. So,
they have to manage many patients.
Yeah,
they have to manage. So it is not their fault, because one nurse has to be handle 5 to 10 number of patients.
Exactly. You rightly mentioned on that part. So they recommended that 20-30% of the time there is a mismanagement of the medications, and sometimes it's very critical. So yeah, with this solutions currently to the hospital, and there are a couple of good hospital tie-ups that are currently happening. We did I'm able to say it loud. We did our clinical trials with the Zydus Hospital in Ahmedabad, and with cancer and BP and cardiac patients. So yeah, we did that, and it was really grateful for that. And we're tying up with a couple of hospitals and that, so they are giving the solutions on a two basis. One of them is they have this care packages with them, that if the cancer patients are there, they have to come every monthly or quarterly to their patients. So they give these devices to the patient as their care package. They add this additional cost to their care package. and in return they get the whole exact data, how much medicines the patients are taking at which time. And secondly, with our devices we'll be able to know that how many medicines are taken and which medicines are left. Let's say you have 3 medicines left, our device will remind you that your medicines are about to be finished, refill that.
Right.
So
Right.
hospital will trigger that as a pharmacy selling, so they'll they'll directly deliver these medicines to the patients. That is second thing. And third thing is, we have the boxes. If
Hello.
branding with them, let's say the other side is hospital, hospital, people know that pain point, and it's real, we are trying to sell that part.
Right. Right. So one more idea. So because each patient has to be occupy one bed, right?
Yeah.
Hospital bed. So each bed is having inbuilt your machine.
Yeah.
That will be more.
Yeah.
I think
But
useful.
for the
Each bed
hospital, yeah, for the
inbuilt.
hospital, we need much bigger device. We talk to the hospital and they interested.
No, number of bed, number of devices, which is
I got
inbuilt
that.
in the bed.
Yeah. We have that model also, but most of the hospital, what happens, they need much larger than, because some of the patient have comorbidity of, let's say, cancer also, diabetic also, and BP also. So for that part, they need more devices onto that. And current devices, you can have 10 medicines, but more than that, and that is also in demand.
Okay, it's a very nice innovation. So I will ask one question: that is it accessible with the mobile?
Yeah, it's accessible with the device. So basically, device creates its own Wi-Fi, and you have to connect with your mobile phone Wi-Fi, as you can connect with it easily. And there is a mobile application available to it. And mobile application, via mobile application, you set your medications, that ye medications is time pe I have to take, and this whole thing is done via mobile application. But after that,
because
your mobile is independent. Let's say there isn't data transfer going on with only mobiles. Let's say I transfer that data, this medicine have to give it at this time, and the device is at home with my parents, so that will work. So mobile is used only for the communication part.
Right. So sometimes you find you will found normally we will use antibiotics, right?
Yeah.
Sometimes we miss to take the full dose of antibiotics. Sometimes after completion even antibiotics, the patient will use the same antibiotics. These things we can avoid.
Overdose.
Yeah.
So
overdose.
we also try to
the same antibiotics, which is not required. At that time, the doctor missed or nurse missed maybe.
Exactly.
I have seen.
Even that happens, that I have taken the medicine after dinner, and after an hour I realized, oh, मैंने medicines लिया था कि नहीं थे, and I take the medicines again.
Second time maybe.
So with the frustration, sometimes that also happens. So with able to do that, we can counter on that part also, because this under medications and over dosage of medications that creates an harmful effect on the patients, and people are aware about it. I'm really glad to know that.
Right. Very nice, sir. And you can add some extra. You can add some extra feature, maybe for old age patient. If the medicine will complete it, will finish on the same device. If they can make a call to the medicine store or something, that will be more useful. Maybe.
Yeah, we are trying.
Medicine will be available to their home. Maybe. So it's a good innovation. Very nice.
Thank you so much.
Very nice. So thank you. And Redicine is redefining medicine, no?
Redefining medicine. Yeah, it's redefining medicine. So we have that vision that we should be able to redefine that world of medications, that where the current adherence rate of the world is around 45 to 50%. We want to increase that adherence level to 85 to 90%. So with our clinical trials, we will able to increase some of the adherence rate on a certain high level. So we have that vision that or people take their medicines on time. With the simple taking their medicines on time, they get the more healthy, and we are trying to approach on to people. There is a whole social side also. So yeah, we are trying to do that with that vision.
Yes. Nice to talk with you. Nice to attend this seminar also. Have you patented this technology?
have patented, actually our idea is patented, and this whole design that you are saying, it is also patented. And the semiconductor is patents. We have currently 3 patents approved and published, and other 2 are in pipeline. Will applying for an international patent next month. That will be also in the process.
Okay, nice. Last question. So is it available in the market now?
No, this products will be available in September in the Gujarat market, and probably in November, December will be available pan India and Amazon, PharmEasy, PanMG, other portals, I guess.
Okay. Okay, that's it from my side. Thank you very much.
Thank you so much, sir. Yeah.
Thank you, Dr. Gurudev, sir. Great inputs. I believe, with these inputs, the product medicine pill box would definitely improve. And when during October, November, it would be available in the market, we may see different variants of this pill box. Any more questions from any faculties or students over here? From Ashu, there is a question like, people often forget to diagnose their progress like diabetics patients. Anything this device can do on this?
Diagnose this process. I think you are saying that the reports that you have to do, or the medicine part.
I think the timely diagnosis, perhaps he is talking about. Ashu, can you just, you can come with your audio and you can ask?
Yeah, if you can come.
That would be great. Okay, yes. So probably this is the timely diagnosis he's talking about.
Yeah, okay, yeah. So probably diagnose, we are trying to do that also. We are trying to collaborate an API that, can remind with your medical test that you are rightly saying that, and it will remind that you are currently diagnosed on this date. After 30 days or after 45 days, you have to diagnose again, and the mobile application will remind you that you have to go for a diagnosis. So that we are trying to do via notification, and with collaborating with doctors or hospitals, we'll be doing that whole approach, that how it can be, if there is an approach, let's say after 45 days your date is due, so the doctor or hospital will directly send the person who will take your diagnosis. Yeah, thank you so much.
Question, Ashu. Any further question we have from the student participant or from the faculty participants? So, Dr. Gurudat, should we call this the end of the session for this? Because the questions are getting... Okay, fine. So, I would like to propose the vote of thanks, Dhaumil, for the beautiful sessions. In fact, I would like to say thanks to the cuckoo, which is adding, beautiful background music also during the session. Yes. So what I believe, when I first see this pill box, and I thought like, let me invite the speaker to our audience so that we can get some inputs. That was met, and remember I requested few focus points, to share with our participant, and you did mention about everything. In fact, you did mention about the journey, plus you did mention about your marketing plans, plus you did mention about the clinical trials that you have. So indirectly you said that for any product, market research is a very essential part. So that need to be done, that need to be carried out. So in fact, some students have some proof or some concepts also in their mind to develop. So that also need to be, concept testing, the way you have did earlier during this, medical conference program. So yes, and you did touch about all the different aspects, starting from research, the way you form the team, and you did mention that ECE, electrical, ये तो मेरी बस की बात नहीं है. And जो आपने share किया, like you were with the multiple NGOs and you were trying to be part of NSS. तो मैं बस एक यही बोलना चाहूंगी, students should also be part of these kind of activities where they can develop this kind of problem statement, because आज की डेट में हर कोई तो entrepreneur है, but what is that uniqueness, the problem what we are going to solve is the question. Like you proudly say that this is India's first pill box which gives this kind of thing. So definitely for this, there are a lot of brainstorming, a lot of phases might have gone, and it is not the product of one night. So this is a continuous process, and now also you are having a lot of brainstorming. So that's how the life of entrepreneurs, continuously doing research and continuously developing. So with this, I thank Mr. Dhaumil Parmar from Ahmedabad, the land of Gujarat, the land of entrepreneurs. As you mentioned that you being the typical Guju, so you being the typical Gujaratis, they can think about different kind of innovations what they can bring to us. So with this, I also would like to thank Dr. Gurudev Patnaik sir and Dr. Himanshu Bhushan Samal, the faculty's member here, and the students. I think there is a last question. Where should he see start market research? So we'll take up this before.
Yeah. Thank you so much, Ashu, for that. So I think market research is I think in the phase of this internet, I think the whole market research and data are clearly available. But once you have that problem, so that's what I was trying to say, that once we see a problem, let's say if I talk about Zomato, they see the problem that they are not having, people are not able to deliver the foods at home. We're talking about Amazon, they experience the whole logistics problem. So yeah, once you have that problem, what you're currently feeling, what is the need that we know, and start doing a research on that part. Internet is a great source provider, I must say, and start searching for that problem. I have this problem, what is the solution? Put that on Quora, put that on Reddit. You'll find multiple things for that. Also, people will give you good solutions if there is any solutions available onto that site. If not, there are also a couple of good agencies that do this market research onto that site. Once you do, that is the legit problem that you have. Trying to go and talk with the problem holders, like for our team, we talk with cardiac patients, we talk with cancer patients, that this is the problem, what would you like to have, what is the solutions that you need. So ask questions. So that is a key thing for an entrepreneurship. I think you might have, once you, if you feel that I don't need to ask anything questions, I have all the answers, you might be wrong somewhere. So keep asking your questions and meet critics more and more. That's what we think, that currently what happens, people don't have patience. That's why I said patience is the key. Try meeting the people who will critique you, that will say that this is not the right solution, what if I have this problem. So that questions will give you a better perspective how to create a better product. So yeah, start talking with people, start researching on internet. That is a basic most thing about market research onto that side. I hope I answered that question.
Yes, you did. Probably Ashu is also satisfied with this answer.
And yeah,
Yes.
I just wanted to say, if anyone have any questions regarding of entrepreneurship, or how to get government grants or any part of that side, I'm available on LinkedIn. You can just search my name rightly and you'll be able to find me over there. What to do to increase product rate in the market more efficiently. Product rate in the market more efficiently, I think the market research is the key part of that. You are talking about the market penetration, I guess. So the more and more thing, that how we are reaching to more and more customers. There are a couple of things for the market research, as you can say. So that is this awareness part, and there is then sales part. So you create awareness. If your product is not aware about the product, try creating the awareness in the market. So currently I'm talking about my product, there is not available the awareness into the market. So what will I do initially? I'll make people aware about that this is a serious issue. With your medication error, you are losing lakhs and crores of rupees every year. So I'll try to them more aware about what is a key thing. And once that the problem, or that the demand rises up, the market penetration will definitely increase. And try to capture your exact set of people. It will be the right key to increase a product rate. If I say about the product, I'll not go to the cold and fever patients कि ये मेरा product ले लो. They'll not be interested. I want to go to the chronic patients, and they have multiple medications, and they have medicines cost onto that part, that medicines are critical. So I want to go to the people who are higher or middle class, or higher middle class people who have multiple medicines to take. So that is my closed customer segment, and that's what I want to tap into. So I think that answers that question.
I think the hospital, the clinic can also do cross-selling of this device.
Yeah, they do that. So that is in key. That's what I thought now. Key hospitals use this at their marketing thing also, and they use it as a selling also. they have this marketing portion also available. They add into the care package. So it's a normal cross selling to them, and even if doctor suggests this kind of thing, patients are easy to buy. So that is the way of selling this.
Should I speak something here?
Yeah, sure.
So it is a medical device, if
Yeah.
I am not wrong. Okay. So for medical device, have you taken any license? Have you applied CDSCO for license?
So yeah, the
DC
tricky
office,
part.
drug control
So yeah,
office.
the tricky part of Indian certification system is this device
Yes.
currently is considered an electronic device.
Right.
Because there is no direct interaction on the health or the human body. But yeah, if we don't need anything to sell this device in Indian market, but we are certifying our product as ISO and CE product. So ISO is an Indian standard product, and will be using as an electronic CE certification, which is a European based certificate that will be using onto that. But yeah, if we go into the US market, there is a certification called 501K, and we have currently developed our product with HIPAA compliances and 501K. So when we go to the US market, product can easily penetrate into that. We just have to apply for it. But yeah, we are taking that parts in consideration, and will be doing that certification rightly. Interested to connect with you, sir. How shall I connect? You can connect me with LinkedIn, I guess. You just type my name in the LinkedIn. It's in the, yeah, madam has rightly put it. So yeah, you can connect with LinkedIn, and I'm very much active onto that part, and Twitter also. But yeah, LinkedIn would be a better way.
Anyway, let me speak something that here on this context. Let me tell you that we have our own institution ethical committee for clinical trials. We
Yeah,
give
for the clinical trials. Yeah.
permission, right? So if you need any time, so you want to do some clinical trial on eastern part, so our student can be involved, and we can pass this.
Definitely. When we want to go, for that whole national thing, I think we can able to do. Or for the
Yes.
next product that we are trying for compact devices, I would love
Right.
to have clinical research go through your college.
It will be our pleasure, sir. Thank you.
Okay, fine. So towards the end of this session, we have a lot of questions. I thank Ashu and Chandan for your questions, and Gurudas sir for your great inputs. As Ashu, I think perhaps was asking this question, if they wanted to do some market research, we have management students, they can help you out there. And as Mr. Dhaumil Parmar was rightly saying, our university would happy to offer you this clinical trial assistance for your mini compact device when you're ready to launch it in the eastern part. So this is the LinkedIn ID where students can connect and they can follow Mr. Dhaumil Parmar for his updates about the product and about his company. In fact, when I visited his LinkedIn profile, there was some internship opportunities also he did share. So probably you people can be part of it. So without taking much more time of Dhaumil and everyone, because students have their examinations, I would like to propose my final vote of thanks for everyone, for all the students and faculties to be here for this program, and especially to Mr. Dhaumil Parmar for coming here, for sharing his inputs and wisdom. So thank you, Dhaumil sir. And if you would like to say final words, you can. Otherwise, we'll call this meeting. I'll end the call.
No, I just want to say thank you so much just joining in this whole great thing, and even after the 7 p.m. I know how it feels when you're asked to attend a session or something like that. But yeah, it's great to know that so many people are interested in this kind of thing, and it really inspired us. I just wanted to say a few things about. So in my journey, I learned about that I wanted to do something on the healthcare side, as even though I was not perfect for I don't have a healthcare experience, I didn't have any this whole electronic development experience, but you'll find some good people. So there is this small thought of Sultanpuri that I always have in mind, that मैं अकेला ही चला था अपने मंदिर पे, लोग मिलते गए, कारवा बनता है. So you'll find good people in your journey. If you have some ideas, or if you find any problem that you're struggling with, start working on it. Have a couple of people with you. No one will tell you no about when you ask for advice. ask people for advice, and create something unique for everyone. So that's it from my side. Again, thank you so much, Madhusmita ma'am. Thank you so much, University, for giving me this opportunity. Thank you so much for all to listening me with good patience. And thank you so much. Hope to connect with you soon, anytime, anywhere. Thank you so much.
Thank you. Thank you all.